I'll just listen to some music until you guys come on in. But happy Diwali, right? We have a holiday tomorrow here in Trinidad. So I hope we all gonna get our pre and post Diwali workouts in. But welcome and happy Wednesday, right? Tonight we're gonna talk about endometriosis. So as you come in, let me just get my music off and let's get started. Right? So the question is whether you can have both endometriosis and PCOS, and the answer is yes, you can. Now, they're both very different conditions. So the diagnosis of endometriosis is very different to the diagnosis of PCOS. The treatment is also very different as well. So what is endometriosis, right? We also call it endo, also known as endo. And I see they have a feature here where I can share a picture with you guys. I'm going to try this and see if it works. And this is explaining really what endometriosis is. So the endometrium is the tissue that usually lines the interior of your uterus. That's designed to shed every month on cycle as your period, right? Endometriosis is when this tissue tends to grow outside of your uterus in locations throughout the body where it's not supposed to be located. So that's what endometriosis is, and that's what I've represented here in this picture. So normally it sheds every month, and that's the endometrium. And endometriosis, it's located in areas outside of the uterus, right? So they have this new picture sharing feature. I'm just going to share one more and then we'll continue on. This next one really shows the locations that we tend to find endometriosis. It's a terrible disease, by the way. We're talking ovaries, fallopian tubes, the tissues that kind of hold and tether our uterus in our pelvis. They get endometriosis along there. As you can see in the picture, pretty much every surface that I've represented here can develop endometriosis, which is why there are stages to it and levels of severity. It can be located on the outer surface of the uterus. So here you see the bladder with the uterus located as well above it, and then the intestines, the tubes, the ovaries. So all of these are subject to endometriosis. You can also find it in the vagina, and that person will present with bleeding, with sex, painful sex, and we can sometimes see these growths from the endometriosis in the upper vagina and on the cervix. In rare cases, it could be found on the vulva for some women, but luckily it's very rare, and the vulva meaning the labia or the lips. Or the interface where the pink area of the labia becomes skin. You can find endometriosis there as well. In this picture, we're looking at the bowel, the bladder, the rectum, right? So some of the symptoms I'm going to go into do have a lot to do with the location of the endometriosis, which could pretty much be anywhere that I've shown on this slide. Also, the belly button is somewhere that we can find a growth of endometriosis in the belly button as well too. There's some very strange cases in the past. I've never seen it, but they've case reports of endometriosis being located in the liver for some women and also in the lung tissue. Again, not very common to find that. It tends to stay lower abdomen, lower pelvic region, and it tends to affect these areas as well, right? So that's me with my sharing of my slide. I'm going to come back here now. I'm back. But I couldn't figure out how to depict exactly where this condition could be located. Now, every woman in here really understands that periods may hurt, but endometriosis definitely has a more distinct feature of pain as one of the symptoms. And it's important to understand this because the big problem with this condition is women tend to get diagnosed in their 30s and 40s, but may have been having really bad periods since they were a teenager. Sometimes from the first couple years of having menses, this can happen as well too. The features of the pain is important. So painful menstrual cramps, but not just painful cramps, but progressively worse. So as you go month to month and you age, your periods are getting worse over time. Chronic lower back and pelvic pain as well too. Again, these symptoms tend to be cyclic, coming up to the period and so forth, but very chronic. And then one classic complaint would be pain with sex. not penetrative pain, right? I try to avoid doing that when I say penetration, but there's pain with penetration. But with endometriosis, pain with sex tends to be described as a deeper pain that may happen during sex, and even last after sex for a day or two after sex, especially depending on the timing of your menstrual cycle. Sex being excruciatingly painful is another key factor as well too. You may have intestinal pain, pain with having your bowel movements, pain with urinating, especially if around the period time you pass blood with your urine as well. You may have endometriosis located in the bladder as well too. Now, the bleeding pattern with endometriosis tends to, again, follow your normal cycles, but sometimes signs of bleeding or spotting in between periods is another factor to be evaluated as well, too. And that's where there might be some overlap with polycystic ovarian syndrome, because there's irregular ovulation with that one, so your periods are irregular. But you tend to more have a key symptom of pain when endometriosis is a problem. And then following that, we have stomach problems, right? In the slide that I showed before, the endometriosis could be located in any of these places, including your colon, your rectum, your intestines, and the upper abdomen is impacted, where you get a lot of bloating and nausea, diarrhea, and constipation as well too. And these are symptoms all women may experience with their periods, but the severity tends to really be quite significant with these symptoms, especially during the period. There's something called endo belly, where the just the massive response of all of these growths shedding at the same time, you really get a very bloated, hard abdomen at times when it's leading up to your period, and then you find relief afterwards. Okay, so I'm going to take this down again. It's a pretty cool feature, as long as I don't share everything that's in my phone with you guys. All right, so these growths that are located in different areas that are called endometriosis or endometriotic growths, these are considered benign. So it's not cancerous, but they can be very problematic. And I often compare severe endometriosis to someone who does have cancer because of the amount of treatments needed, surgeries, and so forth. And these growths, they find themselves in different locations similar to cancer, but it's not cancer. It's not been classified as a cancerous condition. Is very chronic, and we know some of the background of how it's developed, which really doesn't align it with it being a cancer, right? Now, during your period, endo can cause swelling, inflammation, pain, wherever it's located. And the problem is that shedding, that blood that's happening, doesn't have most times somewhere to go. So when you flow and your period is flowing, you have your period flowing out through the vagina, but with endometriosis, this blood is sort of trapped in places. So this is what causes the problems. It can block your tubes, and the tubes will become blocked, which gives a problem with fertility, right? The blood can also grow into the ovary and become trapped or loculated in the ovary, which is what we would call a chocolate cyst, because every month you're having period flow into this cyst in the ovary, every month. And the blood starts breaking down, and I'm just realizing my lipstick is actually the color of what we would find in these cysts. This was not planned, but this is the color. That chocolate color is what we would realize happening within that cyst, and they can be very problematic. We see them in teenagers as well too, and sometimes we have to do surgery. You can also have endometriosis located within the pelvis, where it forms what we call adhesions, which is a special type of scar tissue. So every month blood sheds, let's say in the intestines, and it heals, it sheds, it heals, it sheds. That starts gluing and sticking everything together. So someone with endometriosis will have chronic pain and fertility issues also from these adhesions happening between the bladder and so forth. 11% of women have endometriosis is the estimate. Most of the campaigns, they talk about 1 in 10. That's pretty common. So if there are 10 of us, 14 here in this room, at least one, if not 2 of us definitely would have endometriosis. You can show hands if you know if you do or not. But 11% of women, so that's a pretty common problem. And it's difficult to diagnose it because the symptoms I just listed just sounds like terrible periods. And then also the only way to prove someone has it is doing surgery. And to do surgery on every young girl with period cramps is a bit irresponsible as well. So we end up trying to treat what we think and suspect and manage with treatments prior to leading to surgery, because one of the problems someone with endometriosis will face is having had multiple surgeries, and each surgery continues to add additional risk as well too. So we don't always jump for surgery, but unfortunately surgery is the main way that we can diagnose this. And then it's also, as I said, a genetic issue, right? So if your mother has endometriosis, severe cramps, your sister or your aunt, the woman in the family can tend to get that as well too. And it's sort of blurry sometimes as to whether we should go chasing endometriosis as a diagnosis or not, right? Feel free to ask questions if you have any. Now, who gets endometriosis, right? There's a certain type of person that may get it. We don't know everything about it, but what we do know is if you've never had children before, you can get endometriosis. If your period lasts longer than 7 days on a regular basis, month to month, your periods are longer than 7 days, but your period cycle interval is shorter than 27 days, then you having a longer flow, shorter cycle, shorter interval, that's another sign of endometriosis as well too. Family members, as I spoke about, we're talking mother with severe periods, an aunt, your aunt, a sister as well too, and then that would transfer on to the females in the next generation as well. That's what the studies have shown. And then anyone with a problem where you have a blockage that's impeding the flow of the menses can have endometriosis as well. I have one case that will probably never leave my memory. I was working in Long Island, and there was a 16-year-old that came through the emergency room with worst period, like severe period pains. And she'd been used to having severe pains, but this time around she ended up in the hospital for it. Most of her pain medications, and she'd been there a couple of times, but this time they said, let's see what's going on. So they called the gynae in, and we did end up doing an MRI because the ultrasound was not very helpful to explain what's going on with her. And then we realized this 16-year-old was actually born with a double uterus. So she had what we call a uterine anomaly. So she had 2 uteri. She had her tubes as well and her ovaries. But one uterus, one side, was draining just a little bit through her vagina. So she was getting periods, but the period flow really wasn't matching the amount of pain this kid was in. And then we realized that she had a second womb, right, that didn't have a way to flow. So that womb was actually larger and full of blood, and so we ended up doing surgery, and she's fine, but definitely her fertility and her ongoing issues with her periods would still remain. We did surgery to drain the uterus at that point, but she at 16 had severe endometriosis because for the preceding 4 years, from age 12 onwards, she really didn't have an outlet for her flow, right? So pay attention to your teenage girls, pay attention to how their periods are, and look for progressing pain, things that are just really out of the ordinary to start getting evaluated, right? That's just one classic, memorable outlying case where someone had endometriosis at such a young age. Now, the possible causes really links back to what I just explained. So possibly every month when we're shedding, or even just before we shed, some of the blood that's shedding has what we call retrograde flow. So it goes back up through the tubes, and that's where you will get that pre-period lower back, that pain that goes down to the hip. That is some little blood that's escaping through the tube. So we expect that. But with endometriosis, one of the theories that's being accepted, because we're not sure, is this retrograde flow in some women allows that tissue to sort of transfer itself and become implanted elsewhere. So that's why the thinking is that women in their 30s and 40s, because so much time has elapsed with this condition happening, that's the major time when women will be diagnosed with endometriosis. It's inherited, as I said, so your mother, your aunt, your sister, right, it's inherited. And then if you have an immune system disorder, or what we call autoimmune disorder, endometriosis is your immune system failing you a bit, because it's supposed to just chomp up these areas where the outer implants of the growths are. So if your immune system isn't addressing those, you may also have a thyroid autoimmune disorder, what we call Hashimoto's, which I spoke about in another live. You can have lupus in the family, MS, multiple sclerosis. All of these are autoimmune disorders where the immune system is just haywire, but an endometriosis is now being linked to those as well too. So that's important. Estrogen promotes endometriosis. Estrogen causes the lining of the womb to grow. So no matter where it's located, estrogen can cause that as well too. And then some women didn't start off with endometriosis, but it ends up becoming a problem because they've had surgery, especially C-sections. Those C-sections, myomectomy, sometimes the endometrium in the closure, let's say it's give an example of a C-section, we have to be careful when we're repairing after C-section to close the uterus and not transfer any of that endometrium to other areas. So we even switch our instruments, we switch the needles. We don't try to take that tissue elsewhere, but sometimes inadvertently you may end up with endometriosis in your scar from your cesarean or your fibroid surgery, your hysterectomy. Even that tissue can implant along the scar. Luckily not a very common finding, but it is something that's left on the table as a reason why a woman who's years after surgery still having issues with her scar as well too, right? So who knew on that one? You can't prevent endometriosis. It's just, if you have it, right, it sucks and you have it, but you can reduce how it impacts you and reduce your chances of having symptoms from it by reducing your estrogen. And coming into management of it, if you're already doing some of these things, then your symptoms may not be that severe. So once in a while, I may do surgery on someone for a cyst or something, and I'm like, whoa, you have bad endo, and they're like, I don't even get cramps. They may already be doing some of these things to manage those estrogen levels so that the things that estrogen impacts are not as severe. So the first thing would be to consider hormonal birth control. Right, some people are not comfortable with birth control, but definitely women with endometriosis, that's sometimes the only way they can survive it, being on some form of a hormonal medication in the form of the pill, the shot, or the hormonal IUD. The next way to manage and lower your estrogen is exercise, right? So hopefully everyone's planning their pre and post Diwali workouts, but exercise at least 4 times weekly is recommended to manage estrogen levels via managing your body fat percentage. By reducing body fat percentage, you reduce your circulating estrogen levels, and the endometriosis will improve with exercise. And most people who do give it a try will always say that, yeah, those 4 months that I exercised last year, my periods are better, right? So that's exercise. You also, number 3, want to avoid large amounts of alcohol, because large amounts of alcohol increase your estrogen level, right? Large amounts of alcohol. Even in men it does. A heavy male drinker will sometimes have what we call gynecomastia, or man with boobies, and then of course essential obesity. So avoid large amounts of alcohol. And also there is some relation within our liver where alcohol will impact how the liver functions, and the liver is where our estrogen is metabolized, right? So you want to reduce that if you have endometriosis. And then number 4, to reduce estrogen is to reduce caffeine. And this is where I just sort of know I'm being hypocritical because I drank coffee today. But you want to avoid large amounts of caffeine. But the studies have shown more so caffeine from sodas, right? Your Coca-Cola people, all the Coca-Cola fans. If you have endometriosis, severe cramps and so forth, you want to back off on those. And also green tea. 1 cup per day. Try to avoid anything more than that if you have issues that are related to endometriosis, right? Treatment for endometriosis, quite limited. One of the worst things ever to have is endometriosis, because sometimes things work for a few months and then you have flares where it's worse. Remember, it's an autoimmune condition. But treatments are typically in the form of hormonal pills, a shot, or the IUD, as I mentioned. Now, if you want a baby and you have endometriosis, you can be treated, but not with those, right? Because those would be suppressing you from getting pregnant. So you would more so be treated by a specialist, because fertility is always at stake when you have endometriosis. So for the endometriosis, we would actually give injections of medication that works centrally on what we call the gonadotropins, that are produced in our brain that push our ovaries to work. So we shut the show down from a central location, and it puts you into a temporary menopause. So some women with endometriosis receive this injection. They're put in about a 6-month phase of menopause, and then attempts for pregnancy happen after the medication ends, and you literally have to jump on board, because the longer away from when you got that temporary menopause, the endo is coming right back. So you suppress allow the endo to cool a bit, allow the pelvis to heal, the adhesions to improve, and see if that gives a chance for fertility. But there is a time constraint, because after that treatment, over time, as the periods return, the endometriosis returns as well too. Now, some women report great relief with what we call complementary medicine or alternative medicine in the form of acupuncture, which I never knock it. I always say if you try it and it works, acupuncture is an option. It works great for migraines as well too. But for endometriosis, acupuncture, chiropractic care, if there's back pains and issues and that works for you. The short list of herbs that you can try as well too, in terms of reducing inflammation, you can do cinnamon, ginger, licorice root keeps bubbling up as an endometriosis herb as well. And then your vitamin B supplements, specifically B1, magnesium. I think every other live I talk about magnesium in terms of cramps, menstrual headaches, and now in terms of the symptoms of endometriosis as well, pre-period, you can use magnesium as a supplement, which also helps with restful sleep, and omega-3 fatty acids, because these endometriotic growths that are all throughout the pelvis, they will sort of heal better when you're on these supplements as well too, right? The treatment is really, as I said, sort of a trial and error at first with medications and so forth, but then we ultimately most times end up needing to do surgery. Sometimes we have to go in there and clean up and look for these locations of these growths and excise them, and that person may get several months reprieve from having severe pains and symptoms after surgery. The problem with endometriosis, as long as you are of childbearing age and ovulating and not being suppressed, the endometriosis will come back, right? So we have a comment here. Oh, thank you. Yes, I'm trying my best to give good advice. Now, so that was the surgical option. Surgery is always a tough decision, because you may end up with multiple surgeries having endometriosis as a recurring issue. Now, in terms of infertility, some studies are saying that 1 in 2 women who are being treated with IVF treatments will have endometriosis. So that's a majority of people going to the IVF center who actually have endometriosis as the reason for their infertility. So that's an important bit of data to chew on as well, that it's a lot more common than you think. And even when you're assuming, oh, my periods are just horrible, over time, if it's worsening, definitely getting evaluated is important, right? Now, research shows that there is a link between endometriosis and PCOS and other health problems in the family. Understanding the fact that this is an autoimmune disorder means that your body's ability to fight things, to fight illness, is impaired or faulty, and it attacks itself instead. So the body's attacking itself and not healing itself. And this includes multiple sclerosis, lupus, and some types of thyroid disorders will be lumped into families with endometriosis as well too. With regards to the link with PCOS, it is possible to have both, but they work very differently. Endo is high estrogen or excess estrogen, or defective way that your body deals with estrogen, and PCOS is excess male hormones, which is androgens. But they do kind of revolve around each other. A woman could have fibroids, endo, and PCOS, right? So different building blocks for what these conditions are based on means that one individual can have both of them. The problem I always encounter is, because they are diagnosed differently and they're treated differently, it means that one might be missed. So usually it's the endo that's missed. It's harder to diagnose, and you're really just complaining about period pains, but they're severe. And the PCOS is easier because there's blood testing for it. It shows up on the ultrasound. The periods are a bit irregular. Even if they're irregular, there are other features of thinning of the hair, facial hair growth, right? I've been pounding you guys out on how these androgen excess create these symptoms, but mixed in there, when I do get my period, I have endometriosis, which also affects my fertility. So I have a double whammy for my infertility as well. So one person can have both of these. It is possible, right? And it's something that, again, speaking with your doctor, not ignoring symptoms that are bothering you are important. You know, and I told someone this week, my week is getting blurry already, that a lot of times in life there are things you really don't have control over, but I continue to maintain that there are things you have control in your health that you can have control over as well, right? So someone says women sure do go through a lot, stay strong. Yes, I second that. And one of my pointers: monitor yourself, know your cycles, know your body, understand what is normal for you or not. And even if it's not, get your checkups and get a chance to talk to a professional and just make sure everything's working fine. And that way you can have some control over your health. And if you're even in the most stressed moment, if you're healthy and stressed, you're still doing okay, right? Now, if anyone has any questions, I'll kind of definitely just give the overview that you can ask your questions. But endometriosis, right, autoimmune disorder with some inflammation that's pushed by excess hormones, right? PCOS is more of risk factors of a family history of diabetes, being overweight, being obese, having rapid weight gain, right, or features of PCOS, irregular or no periods, and multiple cysts throughout the ovaries as opposed to endometriosis. And of course the androgen levels being high and so forth. That's how you differentiate. But absolutely you can have both of these at the same time, right? So if anyone has any questions, there's a new feature I'm going to play with at the next live, where I'm able to share slides. Go figure. So if no one else has questions for me, obviously I've been posting these and you guys can watch them and save them. Endometriosis can be quite complicated, but I think understanding the basics of it and knowing when to get evaluated, it takes you a long way, right? So if there are no more questions, I'm going to sign off for tonight and definitely wish everyone a happy Diwali, all right? And make sure you're choosing your veggies and your greens on that plate tomorrow as well. And let's plan those pre and post Diwali workouts, right? Thank you, everyone. Thanks for the love and have a good night.